Two artists, two different cities, one goal: to make masks for healthcare professionals taking care of people who may have been exposed to the coronavirus.
I've already heard and read posts about people saying they have one mask for the whole day, and it's just wearing a paper mask. So I think it's already hard on our healthcare workers locally.
I had seen, actually through Instagram, on an art meme page of all places, someone had put a call asking for masks, and they had asked for N95 masks.
Okay.
Which that seems like that's the gold right now that everyone needs. But I reached out to her and I said, I can sew. I don't have these masks, but I can sew. Would it help if I made these? And she got back to me and said that yes, that would help. Oh. So I just started sewing.
As coronavirus-related hospitalizations increase in the United States, healthcare workers are searching for alternatives to the required N95 mask. Right now, there aren't enough to go around. The Centers for Disease Control released new strategies to help people working on the front lines protect themselves from COVID-19. In an email, the CDC said homemade face masks should only be used as a last resort. That's because they are not considered personal protective equipment, since their capability to protect healthcare professionals is unknown. Homemade masks are not in line with the typical standards of care in the United States, but there's still a shortage, and the CDC acknowledges that. So the center says if healthcare workers must use homemade masks, they should do it in combination with face shields that cover the sides of the face and extend to the chin or below. Again, that's a last resort. But for some, it's the only option right now.
That's kind of a difficult one. I mean, if there's medical grade, certified component to it, but then again, when you're in extreme situations as we find ourselves globally, you have to be innovative. There's an ingenuity component to this that we have to consider, because I'd say those are better than nothing at all, because we are not completely certain with transmission. They're following two levels of precautions, both looking at the droplet and the airborne. So it's I think people are doing the best they can in shipping in. We have that global shortage of masks, and it appears, based on what all the governors from around the United States are saying, is that we are not getting enough put into circulation.
All over the United States, people like Jennifer and Haley are chipping in and making homemade masks for healthcare professionals until the supply catches up with the demand. In your research, did you find anything about the medical health professionals talking about do-it-yourself masks?
Oh yeah, they're buying them like crazy.
Oh really? Okay.
Yeah, I've seen that a lot. Nurses. Yeah, I had a nurse in Texas buy two of them for me this morning. I offered to give them, and the family donated money to help out with costs of materials and shipping. But yeah, I'm willing to make them and just give them to the hospitals. Sure, that's my goal right now.
I am donating these to the hospitals. I was talking to the doctors that I've been in contact with to please give me notes, like if they need to be short, if the straps need to be shorter, or just anything, just as much as I can help in these times.
What I've been telling all of my nurses is that even though this is, a new novel virus, still all the things that we as nurses were taught in school apply. It's common sense infection prevention. It's, cover your cough, your sneeze. It's wash your hands. Keep a distance from people. It's stay at home. These are the things that we've been using for millennia to, combat the transmission of any illness.